Got the Shadow Health Secretary, Andy Burnham, now in our Westminster studio to tell us more on this. Mr Burnham, you're making an appeal to the Health Secretary, Jeremy Hunt. What are you asking from him?
Well, yes, morning, Eamonn. This is a constructive suggestion to say, should he not bring councils, police services, ambulance services, fire services, everybody who's being affected by the pressure on our hospitals and emergency services together to develop a coordinated plan to see if we can relieve the pressure on hospitals. We heard on Monday that Jeremy Hunt sent an email asking for ideas to relieve the pressure on delayed discharges. Well, to be honest, I just didn't think that was good enough. I think we need more now to sit down with people affected, see if we can get a coordinated response.
Joey Jones was saying to me that you were looking at the whole idea that social services had been cut and this was putting pressure, then A&E and hospitals in general were having to pick up some of the slack here. And that seems sensible. I can sort of see how that works out. But are you telling me that if you get into power, you would then fund these social services, refund them, reverse those cuts?
Well, Eamonn, I have repeatedly warned throughout this Parliament that severe cuts to social care will in the end drag down the NHS, and I think that is exactly what is happening and being played out before our eyes right now. We've got a record number of older people trapped in hospital. They can't go home in a timely manner because the care just simply isn't there, either in their own home or the nursing home placements.
We know that, but would you actually reverse those cuts?
I was just going to come on to that. I've said really that we now need to start to think of the health and social care budget as one. And we have to start caring for older people differently, starting in their own homes and looking after people there. So that's the proposal that I am making. And actually I will set out a plan for that later this month.
But that wouldn't necessarily involve refunding, would it? Restructuring? I mean, presumably you would keep the cuts at the same level, or would you actually spend more money?
No, I think we have to spend money differently, Eamonn. I really
so you wouldn't stop the cuts, you wouldn't reverse the cuts?
Well, I think we need to rethink how the system works, because at the moment, for the want of spending a few pounds in people's homes on decent home care, we have these useless 15-minute visits where people just aren't properly supported. We don't spend a few pounds there, but then we're spending thousands of pounds when people are trapped in hospital beds. We published details before Christmas of a poor lady I think it was in Lincoln, who'd been in hospital for 1 year. I mean, if that is not a signal of a system that just isn't working, then I don't know what is. So I'm saying, rethink how the system works.
Yeah.
Look after people properly in their own homes, and that is a much better way to spend the money.
Mr Burnham, I wouldn't take you on in your care and your compassion for the health service. I mean, you passionately, any time I ever watch you, you seem to care quite a lot about this. But you're just saying to me we have to rethink. You're actually having to admit why the system doesn't work, which is there's no money in the cupboard to pay for the system. Isn't that the stark truth?
Eamonn, honestly, I just don't believe that. What I'm trying to say here is that we don't spend... Councils have been cut to the bone, so they can't care for people properly in their own homes. But then the NHS spends thousands of pounds keeping elderly people in hospital beds. And my argument is that has to change. We won't be able to afford to do that. It's no answer to the ageing society to have an ever-increasing number of frail elderly people in hospital beds. We have to start in people's homes, pile in the support there and look after older people differently, and that means a single budget, a single service for health and social care, and that is the proposal that I'm putting forward.
That is Mr Burnham's proposal. Let us know what you think about what the Shadow Secretary has to say on all of that, and that's one aspect of why we've got pressure on A&E. But what else is contributing to these huge amounts of people? And I put it to you, Andy Burnham, as a politician, you're just like all the rest of them. You won't actually take responsibility, you won't grab this and say to the general public, look you guys, you're going to have to take some responsibility as well. You charge people for prescriptions, why don't you charge them £5 or so to attend A&E? In Sweden they get charged 30 quid for going into A&E.
Well, I honestly don't think that will work, Eamonn. If you charge people to access services, they don't go for care when they should go.
Which may be a good thing.
But no, what happens is they then get more ill and they end up as a much more expensive patient later down the line. It sounds simple, doesn't it, and sounds attractive to some people, not to me actually, but to some people. But in the end you spend more money because people don't get care and then they become seriously ill, and that costs far more than the charge to see a GP or go to A&E.
You're a good man to talk to because you do talk simple, and we want to talk simple to you today because people look at this and say, how the heck is this such a mess? Isabel wants to say something very simple to you.
Well, a solution solution that we came up with here was that why don't we have a GP system at all A&Es so that there's a simple triage procedure and you don't waste the times of those critical A&E consultants and anaesthetists and all of those people who need to deal with those acute cases. You can just go and see a GP 24 hours a day. It's so simple.
Well, exactly. That's a great idea. I mean, lots of A&Es do that, so it's not that it's not happening.
But
I would say one of the ideas,
the
summit. Yes, exactly. The summit that I've suggested. That's one thing I would say. Let's have a GP service at every A&E, so that as those people come through the door, immediately we can separate out who really needs to be in the A&E side and who could be seen by another health professional. That's a good idea. I would go further. I would say, can we not get medically trained professionals back on the end of phones at NHS 111. We used to have that with nurses and NHS Direct, and that was changed. And we have a system of call handlers now with computer screens. I think they need to get back to a system where people can speak to a trusted health professional on the end of a phone. And I would also perhaps look at stopping the closure of walk-in centres. Can we coordinate the use of spare GP appointments across local areas? There are things that can be done, Eamonn, and that's why this summit is important.
Andy Burnham, I could talk to you for an hour. I could talk to you all day. There's so much we want to talk. I know time's against us on this one, but let me just leave you with this thought, or give me your answer to this. 92% of people, despite the headlines I'm seeing in the newspapers, in England are seen on time, on target. Is that really a crisis? And the little pinch I'm going to give you with this is, that's in a coalition-run England. In a Labour-run Wales, that 92% of people being seen on time drops to 83.8%. Talk your way out of that.
Well, overall, the NHS does a great job, and I must say, actually, I feel for the staff right now. I mean, no one's blaming anybody working in the NHS. They're working flat out, and of course, there are problems in Wales. There are problems everywhere. So,
yeah, but it's on your watch. Those problems are on your watch.
But no, well, I'm responsible for England, Eamonn. But you say 92%. Well, actually, that figure doesn't tell the whole story, does it? Because in some hospitals, it's dropped right down to 60 or so %.
Yeah, but if you had an exam, if you and me did an exam, and you were going to offer me 92%, which didn't tell the whole story, or you got a really good 63%, do you know what? I'd take the 92, personally.
But do you know what, though? The figures don't actually matter. What matters is there are thousands of people today waiting on trolleys in hospital corridors, held in the back of ambulances outside A&E, people who just cannot get the care that they need in a very serious situation. That is, in the end, Eamonn, what matters. The statistics, we could trade them all day, couldn't we? The reality is there are too many people in England today being exposed to too much risk because the emergency services are not functioning as they should be. That's a serious issue. It requires urgent action, constructive suggestions, as we've been discussing, and that's what I'm asking the government to do immediately.
Well, if I was your GP, I'd have to say to you, our time's up. So we've got to go now. As I say, we could talk all day. Really appreciate your thought and your take on things. We'll leave it there, Andy Burnham. Thank you very much indeed.